Wellness for Life is brought to you by Back in Motion Physical Therapy and Detroit Lakes Chiropractic.
Hello, I'm Dr. Tom Wilson at Detroit Lakes Chiropractic. I'd like to give people a little more in-depth information regarding neuropathy, the cause of neuropathy, and just everything around it related to treatment, what works, what doesn't, and so on. So neuropathy is a disease of the peripheral nerves. Peripheral means the most distal nerves. So that basically is talking about the hands and the feet. About 90% of patients that suffer from neuropathy, it involves the feet. Some the hands, some both. Okay, so your nervous system starts in the brain, then your spinal cord travels down the spine, and you can see all these yellow branches here that branch off into the arms and off into the legs. Those become your peripheral nerves, and those are the nerves that are involved with neuropathy. But not these large nerves, okay? It's really the smaller nerves that become involved. And I've got a picture here that shows the nerves at a microscopic level. This top picture here is a small nerve, microscopic nerve, and you can see the red squiggly lines around it. Well, that's the small, tiny circulation that goes to that nerves. That feeds the nerve with oxygen and nutrients and keeps it healthy. What happens in neuropathy is that those small arteries become less healthy, and they start to die off. And you can see in that second picture, there's less of those arteries there. At that stage, when that starts to happen, you're going to have symptoms in neuropathy. You might have pain, numbness, tingling, muscle cramping, different things like that. As it progresses and it moves to the next stage, the circulation lessens even further. You really don't want to get to this stage. It can be helped, but it starts to become more difficult. Your symptoms are going to become worse. You might start falling down because your balance is being affected. If you fall down, bad things happen. And then, of course, if we get to the last stage, you certainly don't want to get there. That's where there's very little to no circulation. You can see how the nerve was healthy, and you can see where it's unhealthy. So it becomes very problematic at that stage. Okay, and that's a stage where if people are diabetic or maybe they've lost so much circulation, it can lead to amputation. Okay, it's important to know that there's literally 85,000 nerve endings from the feet that travel up, eventually connecting with the brain. Okay, so how do we find out how much nerve damage you have? With neuropathy, what we do is we test the sensory nerves. Sensory nerves are the feeling nerves. Motor nerves, which are often tested for people with neuropathy, are the nerves that move your muscle. They contract your muscles, they help you stand, that type of thing. And so a lot of our patients, when they come in, they've been examined, but it's usually the motor nerves, which aren't even the problem in neuropathy. So we test these sensory nerves. What are they? Nerves that sense cold, hot, prickly, tingly, vibration, light touch. So we test all these different things, and once we do that, we can calculate the normal function or abnormal function. We can come up with a number of, you have a certain percentage of damage to your nervous system, and that leads us to eventually, well, what can we do about it? Okay, so oftentimes people will come in and they're maybe in the middle range, 30, 40, 50%. That's really where you want to do something about it. There again, sometimes we get patients that come in and they're at 50, 60, 80% damage. We can help you. The problem is that it's just going to take longer and it's more difficult, and by then your quality of life is not good. You're not doing a lot of things. You're not standing, you're not walking, you're not playing with the grandkids and all those things we like to do. So we really tell people you need to be proactive when you have problems like neuropathy. So commonly with medical care, people will get medications, things like gabapentin, Lyrica, that type of thing, and that can suppress your perception of pain. It doesn't do anything to actually treat the root cause of the problem. So while you maybe can suppress the pain, if it works for you, your problem is still getting worse. That's the bad part about that. And I don't know that a lot of people understand that, because neuropathy is progressive. It gets worse. It doesn't get better on its own. And unfortunately, a lot of people procrastinate, and they've got hope that it'll go away. It doesn't. So what we do is give people information so they can make a good decision on how they want to handle their future and what kind of quality of life they want to have. So that's really what we try to do. We give you a comprehensive examination, okay, and then we give you options for treatment. Usually we do things to get you better the fastest possible. There are options. Sometimes people will say, well, I can't quite do that. So we try to work out something that works for that individual to help them recover from their problem. And statistically, as long as there aren't complications, over 90% of people get better, and that's what's so fantastic about our approach. There's very few things health-wise that you can treat to get those kind of results, and that's really what we experience. So if you have any questions, if you have any concerns, if you want to see if possibly you're a candidate for the program of care, call our office and we'll be happy to help you. We can set up an appointment with an examination, or we can just set up an appointment for you to discuss it. And that doesn't cost you anything. We're happy to do that. We're here to help. Thanks.
Wellness for Life has been brought to you by Back in Motion Physical Therapy and Detroit Lakes Chiropractic.